Okay, now we're going to take up enrollment periods. And this is very important because of the fact that we are now entering into our retirement years, and there is going to be possibly different enrollment periods for different people. And so knowing what your enrollment period is going to be critical, because why we don't want to miss our enrollment period. We'll talk about that in just a second. And so with that, let's get into the enrollment periods that we have available to us. We have, specifically if you're taking notes, you're going to have 3 different enrollment periods possible. We're going to take these one at a time. So first off, there's an initial enrollment period. That's for anyone that's age 65 who is not covered by an employer-sponsored plan with that covers 20 or more employees. And so that initial enrollment period, as soon as you hit 65, if you're not covered with an employer plan that has over 20 employees, that's your time to enroll into Medicare. And as you can see there, 3 months before your 65th birthday, and the coverage starts at the first of the month. So if your birthday date is the 24th of the month, why then Medicare will start on the 1st of that same month. And then we have special enrollment periods, and this is for anyone over 65 who's covered as a current worker or a spouse is working, and you do not have to sign up for Part B on Medicare, but your employer plan is going to take care of that. But as soon as you retire from that employer plan, this is going to be what we call a special enrollment period. All right, so this is a good thing. That if the employer is taking care of things, you don't have to necessarily enroll in the Part B and the Part D stuff that we're going to talk about, because your employer coverage will be taking care of that. Lastly, there's a general enrollment period for anyone over 65 who missed the initial enrollment period. So this is going to be something that runs from January 1 through March 31 of any given year. And it's for anybody that has missed something. There's a general enrollment period that goes on there. So, how do you enroll in Medicare? Well, like I said, there's those 3 periods. The initial enrollment period, that when you're 65, you're not with an employer that's over 20, that's your time. Or if you are with an employer, you would have that opportunity to jump into it later down the road after 65. And then certainly the special enrollment, if you miss everything, January through March of any given year, it would be a general enrollment. Okay, there's that general enrollment period right there, January, February, and March. We'll talk more about that as we go along here. And there's that special enrollment period again if you are with an employer. Now, again, I keep alluding to this, that unless you're covered by an employer group that covers 20 more employees, you must enroll in Medicare when you turn 65. This is critical. And so some people miss it. And when people miss it, that is not a good thing. If you're receiving Social Security when you turn 65, then Social Security automatically is going to trigger that A and B if you're taking Social Security. If you're not taking Social Security, then you're going to have to do your enrollment directly through Social Security. And as I said in the earlier things, jump onto SSA.gov, Social Security Administration.gov, and get that process going. All right. And as you can see there, Part C and D, we're going to go over those later, are not automatic. So there is going to have to be some proactive things on your part in terms of other additional things to jump on, because not everything is going to be automatic. There's the SSA.gov, Social Security Administration. I do encourage everyone to get your account over on SSA.gov. And get yourself your own special account there. All right. So the best time to enroll in Medicare is so you do avoid those late enrollment fees, and those enrollment periods can be there. I've talked with many folks over the course of time that missed the enrollment period, and they are now paying a fee that is involved, and it's going to be sitting on you if you miss that enrollment period. There's the late enrollment period fee option right there, and it's not anything to mess with. So who signs up for Part A during the initial enrollment period? Like I said, you look at your Medicare card, you're going to see Part A. Those that are turning 65, that we're going to have that automatically turned on at that point. And Part B is something that's we're going to talk about that in a little bit. Part B is going to be something where it's automatic. It'll be turning on if you're taking Social Security, unless you're covered by that employer plan. And those are the exemptions right there that you will, if you're not working, or if you're self-employed, or you're on COBRA, or you're employed by a company with less than 20 employees, receiving retiree health benefits. That's where that Part B is going to trigger at that point, and it will have a premium. We're going to discuss that in a little bit. Okay, and that's the same thing with Part D. If you were making notes, Part D and Part B are kind of are going to follow along together. So you just make a note of that as you go along. So if you're arriving at 65, here you go. Is basically you can sign up before the month you turn 65, and you can do 1 month after you turn 65, or 2 to 3 months after you turn 65. There are a fair amount of a window, if you will, that is allowed for you when you're turning that magical number of 65. All right, so there's the enrollment periods sitting there, and it's good to know those enrollments as you're jumping into Medicare, what is available to you. And now as we move forward in the next class, we're going to take up and dive deep into that Medicare Part A that is so important. And so with that, let's jump into the next class. Grab your pen and paper and let's do it.